Caribbeans everywhere, welcome to the 2012 International AIDS Conference. Thank you for your commitment to achieving an AIDS-free generation here in America and around the world. You've made great progress, but there's still a lot of work to do. So let's move forward together.
The Caribbean Broadcast Media Partnership has been a major leader in the media response to HIV in the Caribbean. CBMP has trained over 1,000 regional journalists, exposing them to the power of effective reporting on HIV with all the medical, social, and economic consequences. The core principles of live up, love, protect, respect create endless possibilities that resonate with all of us, show the way to an AIDS-free generation. Turning the tide together was the theme of the International AIDS Conference in Washington, D.C. And Caribbean broadcasters were among the thousands in attendance. They were there as part of the Caribbean Broadcast Media Partnership IAS Journalism Fellowship Program. Prior to the conference, the journalists were given extensive training and preparation for reporting on such a major event. Glenn Simon of GIS in St. Lucia files this report on the expectations of the group.
The Caribbean Broadcast Media Partnership on HIV/AIDS brought together over 12 journalists from the Caribbean to Washington, D.C. for the 19th International AIDS Conference, AIDS 2012. Over 21,000 delegates from nearly 200 countries, including more than 2,000 journalists, are in attendance for this biennial event.
Really, one of the reasons that you're here is that we want you to be the champions of incorporating HIV communication across your program genres, whether it's news, whether it's public affairs, entertainment, and each of you represents that mix.
Coordinator of the Greater Involvement of People Living with HIV from Jamaica, Ainsley Reed, is optimistic that the Caribbean journalists will take back the message that the Caribbean can position itself to end the AIDS epidemic.
We know that many people living with HIV have been abused, have been discriminated, such as families abandoning their HIV-positive family members. Workplaces are actually turning out some of their HIV-positive staff, employees. And so it is important for us to look back. What do we need in the response to ensure that the rights of the people living with HIV/AIDS are the driver of our response. So I really believe that the enablement of the environment so that people living with HIV can feel committed enough to come forward and also to be part of the response. It is not good enough for us to come out and say that I'm HIV positive. I need to know how to take care of me. I need to know what I need to take care of my family because I'm still alive, I still have needs, I still have social needs, I still have economic needs, and how do I get those addressed?
Thousands from around the world attended the opening ceremony for AIDS 2012, which saw addresses by numerous leaders in the forefront of the fight against HIV. One of the most memorable messages came from 13-year-old Edube Taylor, daughter of Florence Uche Ignatius, a Nigerian woman living with HIV for the past 14 years. She had a pointed message for all present.
I want all children, to be born just like me, free of HIV. Every single one of them. Please, I am begging. Let us make this world an AIDS-free generation. Let's make it a reality. Thank you.
The message is clear for Caribbean journalists attending AIDS 2012 that they have an important role to play towards changing the tide for an AIDS-free generation.
Grenadian-based Hope Pals Foundation joined a Caribbean panel discussing the importance of people living with HIV being involved in decision-making, seen as crucial in the continued response to the epidemic. Concerns emerged that this issue is not high enough on the agenda of Caribbean leaders and policymakers. More in this special report from Grenadian broadcaster Amanda John.
It is my profound hope that this conference will set us on a path to begin talking about ending the epidemic and turning the tide together.
Listen to my words. We can end AIDS. This time, it is different. This time, together, we will end AIDS.
Turning the tide together is the theme at the 19th International AIDS Conference being held in Washington, D.C. Over 23,000 delegates from 195 countries, including world-renowned scientists, policymakers, advocates and journalists, are attending the historic event.
Thank all of you for helping us fight to lift the unjust and discriminatory HIV travel ban that prevented so many of you from coming to the United States and hosting this important conference. Welcome to the United States of America. And thank you.
It's the first time in 22 years since the International AIDS Conference has returned to the United States of America after the Obama administration lifted the travel restriction ban on people living with HIV in 2009.
The war on drugs is a war on us. The war on drugs is a war on us. The war on drugs is a war on us. Fight HIV. Not people using drugs. Fight HIV.
When it comes to men who have sex with men and sex workers.
The Caribbean also has a presence at the AIDS 2012 with a small delegation of just over 300. Rachel Charles, head of Hope Pals Foundation based in Grenada, is attending the conference and addressed an audience about the importance of the greater involvement of people living with HIV and AIDS in decision-making to the sustainability of the AIDS response.
As we move forward and look at the role of people living with HIV for sustainable response, we can therefore see that it is critical, it is important for people living with HIV to be a vital part of this process because it does give voice, it gives visibility to people living with HIV and for also those affected by HIV. People living with HIV are the drivers of the HIV response, have been and continue to be and will continue to be.
The HIV activist recognizes the importance of the international conference in ending the HIV epidemic, but remains dissatisfied that not more Caribbean leaders and policymakers see the importance of attending the event.
It's unfortunate, however, that yet again the Caribbean tends to be small in numbers in participation. And it could be for a number of reasons. It could be as regards to funding or whatever the challenges are, we don't know. But I mean, you see, the Caribbean, as we know, is second to sub-Saharan Africa with a prevalence rate of HIV. And I think it must be credent and prudent that Caribbean governments, private sector, multi-sectoral, bilateral agencies support the involvement and continuous and aggressive participation of Caribbean people in conferences at this international level.
Other groups and activists present at AIDS 2012 include the Caribbean Vulnerable Communities Coalition, CVC, and the Caribbean Regional Network, CRN+.
Simone Absalom of RJR Group in Jamaica reports that highlighting the issue of the Caribbean agenda, Chair of the Caribbean Broadcast Media Partnership, Dr. Carol Jacobs, expressed disappointment that HIV was not discussed in the final communique at the CARICOM Heads of Government Summit in June.
While acknowledging that the Caribbean has had significant breakthroughs in its response to HIV and AIDS, Dr. Carol Jacobs says the conversation must be sustained.
A head of a country should never leave for heads of government conference without being briefed by HIV people at some level that this is an issue that we have to bring to the table. And I am a medical doctor, so I fully understand the importance of chronic non-communicable diseases. But as I keep saying, HIV cannot be taken off the agenda.
She says leaders must engage their citizens on the importance of a continued response to the disease. If not, programs will become distorted and funding will be harder to get. Dr. Jacobs believes Caribbean citizens have been saturated with the basic information about HIV and AIDS and seem to be suffering from what she coined as AIDS fatigue, but argues that the media should play a key role in keeping the issue alive in the public's eye.
we are allowing it to slip off. It's not their responsibility. It is our countries. It's our region. It's our heads. We have to keep it on their agenda. The heads have a million things.
Dr. Jacobs is speaking at a CBMP workshop held here in Washington, D.C. The event was held in preparation for the International AIDS Society Conference 2012.
Next, we look at the measures needed to reduce stigma and discrimination in Tobago.
Live up, love, protect, respect, and I try to live by that. Be respectful, to the fans. Cricket is one unifying force of the Caribbean people, and as Caribbean people, we have to make sure that our people are well looked after. People don't want to come out and get tested, get the medicine because they're afraid of what people might think. Even if you're infected with HIV, you're still a human being. They're still living, they're still breathing, so we got to love and respect them. But yet still we got to educate ourselves to prevent this type of HIV transmitted diseases and mother to child HIV transmissions. Darren sent me here endorsing the Live Up campaign. 2012, from now on, no Caribbean child born with HIV. We're moving forward, we're educating our people, and it's all about love, respect, protect.
Live up, shout, live up, live.
Should islands like Tobago provide more opportunities to those living with HIV or implement greater measures to reduce stigma against such persons? Omadara Mills reports on measures that can aid in sustainable development while responding to HIV.
With the increased need for HIV funding in the Caribbean while maintaining economic growth, Jamaica's Minister of Health, Fenton Ferguson, indicated that public-private collaboration is beneficial in the treatment and prevention of HIV as he addressed the theme Sustainable Development and HIV, a Caribbean Agenda, at the Walter E. Washington Convention Center in Washington, D.C.
The government of Jamaica recognized the need for multi-sectoral involvement and assured the participation of key government ministries and civil society in its various programs. This multi-sectoral response has succeeded in keeping adult HIV prevalence at a stable level of approximately 1.5% in the mid-90s to an estimated high of 1.7 today.
Research Director Dawn Goddard-Eckridge shared her views on how islands such as Tobago can create better opportunities for persons living with HIV.
The private sector definitely needs to be involved because a large number of people are involved in the private sector employed, and funding can also come from the private sector. I think a lot of programs should be worked not just from government but also in the private sector and as a whole collaboration.
Jamaica, like Tobago, has made progress in the elimination of mother-to-child transmission, HIV treatment through integrated primary health care, and reduction in stigma against persons living with HIV. All measures which can aid in the economic development of these islands. But there's still more to be done in turning the tide against HIV while sustaining growth.
Tisha Hines introduces the Endgame that asks persons living with HIV for ideas they would like to see put into action.
One of the most interesting things that has happened since we came here to Washington, D.C. to cover the World AIDS Conference 2012 is we got an opportunity to see a movie called Endgame.
I was a heterosexual, all-American teenager. HIV and normal didn't go together. So I thought.
The minister put his hand on my head and started trying to cast the homosexual demon out of me.
How could you love me and keep such a secret from me?
We've been at this for 30 years. We need to be talking about Endgame.
Jesse Brooks is one of the activists we saw in the movie Endgame, which we got an opportunity to screen as soon as we got into Washington, D.C. Jesse, what has been your struggle over the last few years since you decided to come out and be an activist for HIV/AIDS and all that you stand for?
Actually, my struggle ended when I decided to do that because I cried inside, and once I gave myself a voice and I freed myself, from all the stigma, from all the shame. And what I found out, it wasn't the external stigma that I had fear around. When I walked through the fear, I found out it was the internal stigma.
We also caught up with Dr. Carol Jacobs. She talked about the importance of Barbados being a part of a conference like this one.
I think it's important for a number of reasons. Let me start out by saying that I think it's really important from this perspective of the Caribbean Broadcast Media Partnership to have Caribbean journalists from around the region here doing stories, but also having a wide exposure, having the opportunity to network and just growing in terms of reporting on HIV and knowledge base.
Another representative is Live Up hero Corey Lane. He shared exactly what he plans to do with the information he's gathered here in Washington.
What I'm looking forward to is to taking out some of the key ideas, crystallizing them and putting them into action. And I think that is the major focus for me. And I'm hoping that a lot of people look at a conference such as this in Washington this week, where we can use the ideas to propel into positive action.
And this is the one place where we finally get to see people who are willing to share their stories of living with HIV/AIDS.
I remember a few years ago I was stabbed up. I was left on the street to die. Now I'm embraced. In Jamaica, I'm one of the many faces of HIV/AIDS in Jamaica. And so the Jamaican population has been very, very, very open with their support and love.
And with people living with HIV advocating for greater involvement and less stigma, what role can the faith-based community play? While in Washington, D.C., Kamika McCrae of RETV Jamaica looked at the role of the faith-based organizations in the fight against HIV/AIDS.
The church has no barriers or boundaries. It is the home for the sick, the hungry, or the indifferent. On the quest to end HIV/AIDS, the 2012 World AIDS Conference highlighted that it's not only the scientists and the government that play a vital role, but also the faith-based organizations.
In December of 2009, the Joint United Nations Program on HIV/AIDS, UNAIDS, published a strategic framework that described the organization's commitment to developing stronger partnerships with faith-based organizations in the fight against HIV/AIDS.
The faith communities have the biggest network that reach the most hard-to-reach areas in countries that perhaps the government system does not reach.
And what we have come to believe is that when there is that kind of synergy between the government, between private sector, and between the church, the faith community, that there is traction that can be gained on almost any issue that you want to address.
But there are people who, up to now, don't want to hear anything about the church.
Our duty to do the work for the community.
All what they need is, can you provide the positive reinforcement where necessary?
Where you live and who you love and what you do, can they add to your risk of contracting HIV? Find out when we come back.
Part of living is going out and making good informed decisions. This is the most powerful defense in my mind of our generation. We have a serious problem with AIDS. We have a serious problem with a lot of things that young people are dealing with. But we have to be the one that create the social movement that change it. We have to be the change agent we're looking for. Remember, live up, love, protect, respect.
Live up, shout, live up, shout.
Is there a difference between who gets access to health care? Devon Hunter highlights how social inequity compounds and complicates the risk factors for HIV.
HIV intersects at a space that touches on several sensitive and deeply personal and cultural issues. It forces us to talk about sex, homosexuality, our faith traditions, justice, and our very humanity. So while the science marches on to provide better testing and treatment options for HIV, it will mean very little if we refuse to improve our social responses to HIV. According to Dr. Lisa Fitzpatrick,
HIV is as prevalent as it is in
actually worldwide when you think about it. Across the Black diaspora, it seems that the health disparity in HIV/AIDS is consistently in Black communities. And I think this is a very complicated question, but I think it has to do with sexual networks and partner choices. I think Black populations are more likely to engage in sexual behaviors with people from their own background. So Blacks tend to engage in sexual relationships with Blacks. I also think that across the Black diaspora, Blacks have the highest rates of poverty, homelessness, substance abuse, and maybe even mental illness. And I think all of these social issues compound and complicate risk factors for HIV.
She sees a significant part of the solution moving forward is having HIV screening as a part of normal health screening protocols.
HIV screening should be integrated with routine health care. And the reason for this is because HIV testing remains a stigmatized issue. So people are not presenting for screening because they don't want to know they're infected. If they find out they're infected, a lot of people don't feel comfortable talking about their diagnosis or disclosing. So if healthcare providers around the world would automatically test for HIV and treat this as the treatable disease it is, similar to diabetes or heart disease, we test people for these conditions all the time, but we don't integrate HIV screening. And I think that's one of the single biggest things we can do to eliminate the stigma from HIV is to routinely test for HIV.
She goes on to make the point that while there have been major gains,
we have made a lot of achievements and successes in addressing the HIV epidemic, but we still have a lot of work to do in some of the most basic areas of this epidemic. For instance, we are having a difficult time ensuring that people who need information, basic information about HIV, know about HIV, knowing where they can get a test, knowing where they can get treatment, knowing how the virus is transmitted. We are also having a very difficult time shedding some of the stigma associated with HIV. So people are ashamed to be tested and ashamed to be associated with this virus. And I think before we can really end the epidemic, we have to address those two things, education and stigma.
For those who believe that HIV must remain a scary and stigmatized condition, Dr. Fitzpatrick had this to say.
If the fear goes away, then maybe people will be encouraged about testing and seeking care. If they get on medication, their virus is controlled, they're much less likely to spread the virus. We know that people who have their virus controlled are 96% less likely to spread the virus to someone else. So it would be okay if the fear goes away. I think fear is appropriate for a certain population, maybe young people. But I think overall, fear is also part of the problem. I think the fear helps perpetuate the stigma associated with HIV.
The future of HIV and the race to zero is not something that the Global Fund or the US can achieve. The only one that can is you. Dr. Fitzpatrick's prescriptions are
the traditional prevention strategies that we've had. People need to know their status and their partner's status. Abstinence is still a mechanism for prevention. Condom usage, but condom usage has to be consistent. So I think treatment as prevention is appropriate, but it has to be in conjunction with other forms of prevention, the traditional approaches that we know about. And also the education is a form of prevention, because if people have the information they need, they're more likely to get tested and follow up with providers, take their medication so that they can be healthy.
So, will you always use a condom? Will you support and pressure the government to ensure that no child is born with HIV? Because irrespective of what you feel or believe, we are all either infected or affected by HIV. So, live up, love, protect, respect.
During the International AIDS Conference, the Vulnerable Communities Coalition and the Caribbean Broadcast Media Partnership led discussions at several CVC press conferences with sections of the most at-risk populations within the Caribbean. The aim was to allow for meaningful exchanges between regional journalists and advocates and shine the spotlight on the issues directly affecting them. Glenn Simon reports.
You know I'll keep holding on.
This was a performance by the Gay Men's Choir from Washington, D.C. at the opening ceremony of AIDS 2012, which set the tone for numerous discussions that followed on issues affecting people living with HIV. The numerous press conferences conducted by the Caribbean Vulnerable Communities Coalition highlighted issues related to men who have sex with men, transgender people, sex workers, migrant populations, people living with HIV, to name a few. The following clips represent the main issues coming out of these press conferences.
One of the hard things about the Caribbean is, and what we've been talking about in terms of this conference, is context is everything. Particularly in the Caribbean, we have high rates of stigma that's associated with HIV, as well as high rates of stigma against gay men and lesbians and others. We actually have had high profile individuals who were killed for being gay in the Caribbean, and that certainly has ramifications in terms of access to HIV prevention services.
There are so many challenges that, as a young person who is living with HIV and also as a young gay person, there's so many challenges that we face within our communities across the region, from low self-esteem, stigma and discrimination, suicide, mental health, because there's no proper mental health services that really address our needs, unemployment, unfair treatments and unequal opportunities.
One of the most important things personally for me, and I believe that other members of the GLBT community can identify with, is the inability to live our lives free of discrimination, be it verbal or physical discrimination, and the fact that there are laws, the Buggery law, that remains on the books in Jamaica that criminalizes same-sex relationships.
Over and over again in studies, you see that gay men in the Caribbean are far less likely to go to the doctor, particularly if they have a rectal STD, compared to other individuals, because they're afraid to admit that they had sex with another man. They're far less likely to access condoms or even to access lubricant.
Yeah, you have condoms all over the place, but for us to use it properly and for us to use it effectively, the challenge is that we don't have access to lubricants. Or if we go to buy it, you have this funny look. What do you want to buy it for?
Things like that gay persons or transsexual persons, transgender person cannot complete the basic education because of the discrimination based on sexual orientation and gender identity.
But because this society is so gendered, everything from, we have female restrooms, male restrooms, we have school uniforms for boys and for girls, we have pink and blue for babies. People are, they only function in a world that has two genders, when in fact there's a spectrum of how you feel.
If we were not living in a region that had the kinds of levels of hostility, of stigma and discrimination, you would find more persons who would want to live in the way that their body is commanding them to live.
Youth, as growing up, because you didn't have the chance to sign your own birth certificate, you didn't have the chance to sign your own passport. There was what your parents or what the government chose to put for you. But if we as trans was able to make our own choice to put our birth certificate the other way around, we would have put it trans or female, male from female at trans.
For lots of people, you're considered a monster. And so in prison situations and in the public, subject to physical violence in lots of situations.
As to where St. Lucia is, I think our major conversation need to be with our religious groups, and we need to be able to understand how can we teach the word of the Lord without making it a subject of intolerance or fear.
And I'm really disappointed with our governments and even with our leaders, even within the church communities. And even that they don't know, there's so many people who are hidden in the churches for that reason.
The most at-risk populations within our Caribbean society are advocating for government leaders to embrace their challenges and implement policies that help reduce stigma and discrimination.
You're rolling a racetrack. Got these fellas that are driving
ignorant on the road. If you want to drive like that, go up the track. And I got tested for HIV on Tuesday. I mean, I ain't no worry, because at the end of the day, you know, I ain't doing no stupid mistakes. You know, I ain't getting drunk and having unprotected sex. You know what I mean? I got a wife now, so that don't happen. So you gotta respect yourself. Don't do stupid things. Don't drink and drive. Don't drink and have unprotected sex. I'm Barry Mears. Love, protect, respect. Live up.
Live up, shout, live up, live.
Due to strong public-private partnerships in its response to HIV, the Jamaican government has kept its adult prevalence rate down to 1.7%. When Sir Elton John addressed the Washington conference, he made the call for public-private partnership to move center stage everywhere if HIV/AIDS is to be an epidemic of the past. Carlton Pickering reports.
After 31 years and 30 million people gone, we have seen both responses, you and I. We've seen hate in Uganda, stigma in Ukraine, indifference in America. We've seen gay people targeted, discriminated against, and even killed. We've seen people living with HIV ostracized by their families and stigmatized by their communities. We've seen AIDS orphans abandoned in the streets, children raped and abused. It makes me feel sick. All of this fear, all of this ignorance and hate.
After 3 decades of research and providing service, it seems possible that the beginning of the end of finding the right strategies which can scale down the HIV/AIDS epidemic is within our grasp, turning the tide together. The increased initiatives of public-private partnership, communities, NGOs, and individuals must be bold and committed.
Maybe you think I'm naive. Maybe you think I'm off my rocker. Well, here I am, telling an audience of 7,000 global health experts that we can end AIDS with love. I know we need more than that. We need prevention programs to be funded. We need treatment programs to be expanded. We need critical research to continue. We need a vaccine to be discovered. Everyone at this conference is united by the dream of universal treatment, prevention, and a vaccine. We dream about it every day, you and I. And God bless everyone who is working to make that dream a reality.
And that reality is going where the communities are. This partnership must come center stage if HIV/AIDS would be an epidemic of the past.
Simone Absalon reports that Jamaica's Health Minister, Dr. Fenton Ferguson, says that country's continued success in its response to the HIV epidemic should encourage more funding from international partners.
Since 1988, Jamaica has taken various approaches in its response to HIV and AIDS. Dr. Ferguson says that type of response has succeeded in the adult HIV prevalence being stable at 1.5% in the mid-90s and 1.7% today.
The Ministry of Health has the centralized HIV prevention, treatment, care and support. According to the minister, that initial approach has contributed to the country's successful response to the impact of the disease.
If you look at our AIDS program rollout since 1988, we are way ahead of many countries in terms of our systems and infrastructure. And in spite of the difficulties, I am optimistic that we will be able to maintain our programs.
At present, the country receives $8 million per year to fund its programs. Dr. Ferguson says we will only need $3 million come 2015 if the present funding is sustained.
The move to make funding decisions based on limited criteria such as the World Bank country ranking without wider economic and potential impact assessments will be judged an error by history if it's allowed to stand. These decisions threaten the very life of the people we have just saved.
In 2002, the government took out a $15 million loan from the World Bank for the expansion of Jamaica's HIV programs. Another $10 million was borrowed in 2008. That loan will be completed this year. Dr. Ferguson says with the country's potential for funding dwindling, the government is moving to maximize its response with a more integrated approach.
And part of that strategy is going to be the merger of the national family planning board with the National AIDS Program. While that is taking place, the intention also is to continue to strengthen the primary health care, which has to do with our health centers, the continued service for HIV within the primary care thing, which is something that Jamaica did from almost day one.
Racing to Zero, the efforts to ensure an AIDS-free generation, next.
Driving around on the public road fast is a hazard. Drinking and unprotected sex is just another example of careless and irresponsible behavior. I think it's really important for young people to try and actually be engaged in what is smart and what is right for first yourself and then others. That mutual respect needs to be nurtured. So from the circle, love, protect, and respect. Live up.
Live up, shout, live up.
Zero is generally not a desired number, but in the world of HIV/AIDS advocacy, it's a goal, as this Devon Hunter report reveals.
The 19th International AIDS Conference is abuzz with excitement and hope, not for a cure for HIV/AIDS, but in the idea of racing to zero. Zero new infections and zero transmissions of HIV from mother to child by 2015. While the science supports the thinking, is it likely and what would it take? According to
Philip Amusoke, a pediatric infectious disease specialist based at Makerere University, for the Caribbean, which is probably similar to sub-Saharan Africa, it's going to be an uphill task, but it can be done if people are willing to commit, which means that the politicians need to commit, the ministries of health need to commit the finances, the people and the researchers need to commit to find strategies to actually implement what we know works on the ground, in the field, at the lowest level, where the mother can actually walk to the place where the services are as opposed to coming to a central town. It does also require innovative ways for the community to be involved and actually embrace this new decision to reduce mother-to-child transmission or eliminate mother-to-child transmission to zero.
She went on to explain how the B+ treatment option would help in delivering on the zero goal.
B+ is a new option that WHO is going to recommend probably next year for most countries in developing world, because currently option A and option B, a mother takes either prophylaxis, one drug, or many drugs, triple therapy, to prevent her baby from being infected, but not specifically for her own health. That regimen requires that you know her CD4 count, you know her immunity. If she has low immunity, she goes on treatment. If her immunity is still intact, then she just gets it to prevent her baby from being infected. It has worked for a while, and for some countries have been successful, like Botswana and even South Africa, using those regimens of prophylaxis. But the concern has been that we will not get to zero by 2015 unless we have a more concerted effort to completely reduce the number of babies infected. And the way to do that, regardless of the state of the mother, meaning her immunity, that every pregnant woman who's HIV infected gets treatment for her health, for herself, but also gets treatment to reduce mother-to-child transmission and continues for life.
In spite of the fact that the Caribbean has the second highest prevalence rate of HIV in the world, with an estimated 50 new cases of infection each day, the Caribbean is projected to be the first region to have zero transmissions of HIV from mother to child. This race to zero is one race that we must win, because it is a race for very survival.
We all need it. We all want it. So Elton John talks about it. Addressing thousands in the US Capitol and reaching millions more viewers around the world, pop icon and founding partner of CBMP, Sir Elton John, underscores the importance of compassion in the fight against discrimination and credits it as the reason why he survived the life of a pop star in the 70s and the 80s. Tisha Hines shares the love in this report.
Sometimes I've had to do a double take walking through the halls of the Washington Convention Center. Oftentimes people would pass by and it's so surreal you don't understand these are the most powerful people around the world who are here with one message in mind. One such man had an opportunity to speak with huge audiences, thousands here at the Washington Convention Center, and even more viewers online and through the media. It's pop icon Elton John. He spoke about the importance of compassion in the fight against HIV/AIDS, and he further talked about how love changed his life and helped him survive as a pop icon of the 70s and 80s.
Ladies and gentlemen, by all rights, I shouldn't be here today. I should be dead, 6 feet under in a wooden box. I should have contracted HIV in the 1980s and died in the 1990s, just like Freddie Mercury, just like Rock Hudson, just like so many friends and loved ones of yours and mine. Every day I wonder, how did I survive? I don't know the answer, and I never will, but I do know why I'm here. I'm here to deliver to you and to anyone who will listen the message that saved my life.
Popular people speaking out seems to be the one thing that is driving change in the most vulnerable and at-risk communities. Sir Elton even made reference to President Obama speaking out on gay marriage.
First of all, the Secretary of State, Hillary Clinton, made the most amazing speech. And then the Vice President made a speech. Then the President endorsed gay marriage.
I've always been adamant that gay and lesbian Americans should be treated fairly.
And then Jay-Z, who is one of the most respected artists in his field in the world, made an incredible statement supporting gay marriage and saying any criminalizing discriminatory behavior in the world is wrong. For him to have said that, as an African American and as a hugely respected person, it meant that the dominoes fell. 3 days later, the NAACP said yes, and then Colin Powell said yes, and then Frank Ocean, the hip-hop singer, said yes. It was like a domino effect.
Sir Elton John shared one consistent, strong message this week: love conquers all.
We need more than medicine. We need more than money. We need love. Now, if that word makes you feel uncomfortable, if it makes you feel a bit uneasy, if you associate it with Disney-esque schmaltz, let's pick another. Compassion, kindness, understanding, empathy. Call it whatever you like, but the idea is the same.
As the region with the second highest prevalence of HIV in the world, the Caribbean cannot afford to drop the ball when it comes to our response to HIV. It is a challenge to our journalists to continue to expose the problems, shine a light on the many successes, and generally ensure that a well-informed public will be able to make healthy choices for themselves and those they love. As our CBMP broadcasters in Washington demonstrated, those that have benefited from association with the Caribbean Broadcast Media Partnership are ready, willing, and able to live up, love, protect, respect. I'm Julian Rogers.
No matter who you are or who you love, no matter where you live or how you live, no matter what you have or haven't done, everyone deserves compassion. We need more humanity, more love if we're going to end AIDS.
Love, protect, respect, live up!